Chapter 15, still the nervous system. These are the learning outcomes that we're going to learn. It's more of the somatic part. Remember, there is somatic and visceral, or somatic and autonomic. This is more of the somatic part. General sensations, the pathways, the tracts up and down, and the reflexes, and so on. The different things, and we will discuss the details. So it's more of sensory and motor pathways, especially somatic nervous system. Sensory pathways. This is how the sensation work, and it is the same that we talked about before. Starting from the receptors, afferent, central nervous system, right? Efferent, and then the effector. It's the same thing, but the control center here is the brain instead of the spinal cord. So you have the afferent division, just like the spinal part. You have efferent or efferent, somatic, and visceral. This is generally speaking. So starting with the sensory part, we have the sensory receptors. These are the receptors that receive the sensation. What is sensation? Sensation is just arriving information. You're not aware of it yet. Just arriving. This is called sensation. Perception, on the other hand, is another term that is the conscious awareness. Okay, so we need to know this difference, sensation and perception. What are the general sensation? Anything that's not special sensation. You guys know the 5 special sensations. We know the 5, right? Anything else is general sensation. Touch, pressure, vibration, pain, temperature, proprioception, everything else is general sensation. So here are the special sensations that we talked about, and anything else is general sensation. Receptors are specific. This receptor is responsible for touch and pressure, for example. This receptor responsible for vision. So these receptors are specific, so there is specificity, and they have certain degree of sensitivity. What determines the degree of sensitivity? The receptive field. Meaning, if I'm a receptor that's monitoring this area only, I'll be very sensitive, right? If I'm here, I watch her. If she did anything, I can easily tell all the details. So I'm sensitive now. If my receptive area is the whole entire class, big receptive area, of course I will be less sensitive and less specific, right? If I'm looking here and somebody did something here, maybe I don't see him, right? So the bigger or the larger the receptive area or the receptive field, the less the sensitivity and specificity. Transduction is when you convert these stimuli into electrical signal. We call that transduction. So what does the receptors do? Transduction. They get the signal, they convert it into action potential. And because this is what's actually going to travel down the nerves. Look at the receptive field. Here is one receptive field. Here is one receptive field. This is bigger, a little bit bigger than this. So this will be less accurate, less sensitive. These are the special sensory receptors. Receptors for taste, hearing, equilibrium, and vision. And then the interpretation of each one of those is when you hear when you touch something, when you hold something, when you do pressure on something, how do you perceive it in the central nervous system? There is a term here that's called adaptation that you need to know. What's adaptation? When you got adapted to something, like I give you a simple example, if you're wearing a hat all the time, don't you forget about it? Sometimes you put your hand like this, am I wearing my hat or not? You forget about it, right? Your receptors are adapted to it because of 2 things that has to be fulfilled to achieve adaptation. What are those 2 things? Number one, it's not painful. Number two, it's something continuous, right? If it is painful, like if there is touching you with something hot, can you get adapted to it? And then, yeah, that's okay. I got used to, or a nail or something. If you insert a nail, can you get used to it? Of course, never. There is no adaptation if it's painful. And what if I get the hat? I take it off, I put it back, I take it off, I put it back. I will never get adapted to it. So you get adapted to it if you fulfill two criteria. Number one, non-painful. Number two, continuous. Another example. Don't you did you ever go to somebody and there is like smell that's not nice or something, and you tell them, what is this? Don't you like smell something? No, I don't smell anything, right? Why? Because they are adapted to it. It is not something that's very bad. It's just a little bit, and it's continuous. They live there. It is there, and it is not something that's sharp or something that's too bad, right? So they get used to it, and when you come out to them, say, don't you smell something? No, I don't smell something. They got adapted to it. And when they leave and come back, they will smell it, right? Because they lose their adaptation. So most importantly is two things, non-painful and continuous, okay? You can get peripheral adaptation and central adaptation. Peripheral is these receptors outside, like touch something, keep on touching it. You forget it. You get adapted to it. Or your brain get adapted to it. But it has to be painless and continuous. Receptors are different types. Some of them are called the tonic receptors. And tonic means they have a tone, means they are active. And these ones are slowly adapting receptors. It takes time to get adapted to it. Pain receptors is part of it. Slowly adapting means if there is something that's a little bit painful, not very painful, not painless, something in the middle, just a little bit painful. You can get adapted to it, but it will take, like, I'll give you an example. Like if I have a little bit of pain in my knee, I can get adapted to it. It will take me some time, but I can forget it, right? But every now and then, I will feel it again, right? This is the slowly adapting receptors. You get a reminder every now and then. Phasic receptor, on the other hand, these are the ones that are normally inactive. That's the normal. But you activate it, and these are the fast adapting one. It get activated when you stimulate them, and they are fast to get adapted. Of course, this is the one that's non-painful and continuous. So these are the phasic that are normally inactive. According to the location of the receptors, the sensory receptors, if these receptors are monitoring something outside, it's exterior, isn't it? We call it exteroceptors. Exteroceptors, like touch, pressure, vision, hearing, something that's outside. You are receiving information from outside of your body. We call that exteroceptors. If the information is monitoring the inside of the body, this is the opposite, interoceptors. Clear? Are we good so far? Clear? I think it's very simple. There is a third category that's inside your body, but they don't classify it under those two. They put it alone, which is proprioceptors. Where are the proprioceptors? Proprioceptors are located inside your joints, in the muscles, in the joints and muscles. And these are to monitor your position. So wait a minute, isn't this is inside the body? It is monitoring the body? Yes, but not inside your trunk. It's just inside the joints. So they put it in a separate category and they call it proprioceptors. Position receptors. Proprioceptors, position receptors. Pain receptors are called nociceptors. The temperature receptors are called thermo, and you do need to know that. Physical receptors, the ones that work with the physical distortion are called mechanoreceptors. The one that respond to change in the chemistry or the chemical concentration, chemoreceptors. Nociceptors, the pain one, does it respond to pain only? No. It is free nerve endings. This is this is how the receptors looks like, the nature of the receptors, free nerve endings. Okay? And this is the one that perceive pain. But there is another thing that can be perceived as pain, which is extreme temperature. Isn't it painful when you touch something that's hot? Can be painful, right? If I give you like an ice cube and you hold it for some time, don't you feel pain after some time? Yes. So if there is anything extreme, too hot, too cold, this count as pain. It goes or stimulate the pain receptors. So those two, like temperature, it's not thermoreceptors, not if it is extreme. Did you get this? So anything in between, reasonably hot or cold, this is thermoreceptors, the temperature receptors. If you exceed it and you go to the extremes, they don't work on the thermoreceptors anymore, they work on the pain receptors. Nociceptors, nociceptors, the pain receptors. What kind of nerve do they use? Do you guys remember this? Type A, type B, type C. Do you remember this? Myelinated, large diameter. Okay, so what are the nociceptors or the pain receptors using? They use type A, the best one, especially for prickling pain. What's prickling pain? Pain is something like injection, like a nail, like glass, a piece of glass, something that's sharp pain. This one is using type A because you have to be aware of it immediately to take an action. And these are going to end up going to the primary cortex. Remember that what the primary somatosensory cortex? The primary cortex, where is it? In the cerebrum or in the cortex, the cover? In the cortex. It's part of the cortex. Do you remember these parts? Cortex. It's in the cortex. So cortex, when you hear cortex, awareness. Cortex, consciousness, awareness, the highest. How about if this is not that sharp pain, not that prickling pain? If it is like low magnitude pain, something that's dull aching pain, they call it, like knee continuous pain, low magnitude pain. Are you still using type A? No, you use type C. And this will be stopped at the thalamus. The one that's sharp, prickling pain, cut, injection, glass, something like this, sharp pain, thalamus allowed to go to the cortex. Clear? What if it is this low magnitude pain, like a little bit of painful, and something continuously painful but low magnitude? Would the thalamus allow to go to the cortex? No, the thalamus will stop it. Why? What if I have continuous low grade pain in my knee and the thalamus allowed to go? I will never fall asleep, right? If the thalamus doesn't stop it, I will never fall asleep. So in this case, using type C and the thalamus, no. If you're coming to me using type C, I know that you're not important pain. Why? What should I do immediately if I get knee pain that I have it for the past 5 years or even the past month? What is so important? What's so urgent? Why should I use type A? Use type C. Next is thermoreceptors. And again, thermoreceptors are also free nerve endings, but it detects a sensation within the normal range, not extremes. And it's not only in the skin, it's inside of your body too. We have some of them in the skeletal muscles, in the hypothalamus because of the thermoreceptors. And they go to the thalamus and they might go to the primary cortex if it is something like too hot or too cold, if we need to be aware of it. Most of it will go to the thalamus and passing it to the primary cortex. Mechanoreceptors, these are the ones that respond to mechanical distortion, like this. Like if I press on this, right? In this case, the receptors are like balloon, right? What happens if you press on the balloon? Isn't the shape distorted? It works by distorting the shape, like stretching, compression, twisting. You do something physical change to these receptors. This will result in mechanically gated channels to respond and start electrical signal. And there are categories of these mechanoreceptors. Tactile, tactation means touch. Translation, tactation is touch. It's touch, but also pressure and vibration go to the same ones. Baroreceptors, what's baro means? Baro, prefix, what does it mean? Pressure. Baro means pressure. So these are the ones that detect pressure. What do you mean by pressure? Like if your stomach is full, that's pressure. If the urinary bladder is contain a lot of urine or filled with urine and start to stretch, right? Blood vessels, if your blood pressure increase, stretching it. So these will be the baroreceptors. Proprioceptors, this is the last one, using the same mechanoreceptors. And again, these are the ones in your joints and muscles in order to respond. What's the function? Just this is the last thing. What's the function of the proprioceptors? What do they do? Position and balance, specifically position. Okay, it's position to help you with the balance, but position. That's why it's located in joints and